Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about what communication is, what are the levels, what is the communication process, as well as the flow of communication. In today's session, we are going to learn about what are the various modes, types, as well as the factors which will influence communication. So now here, moving on to the modes of communication. So what do you mean by modes of communication? Here, modes of communication means how will you be able to communicate or to transmit the information. Here, there are various modes of communication. The first one is the verbal communication. So what do you mean by verbal communication? As I've said, communication is the process of exchange of information, right? So here, this verbal communication means the process of exchange of information verbally by the use of words. So here, whenever you are communicating through speaking, this process is known as verbal communication. Here, the most important aspect of this verbal communication is the language, the pacing, the intonation, the clarity and brevity, as well as the timing and the relevance. So whenever you are communicating to anybody, whenever you are transmitting information through speaking, it is very important that the language must be clear. It is very important that the language must be common for both you and the person with whom you're communicating with. Suppose now if there are two people belonging from different states communicating with each other through their own language, then this communication will not be effective, as the other one, who doesn't know the language will not understand what is the other person speaking. So it is very important that the language which you use while communicating must be understandable both by you and the person to whom you are communicating. And the next one is pacing. What does pacing means? Pacing means the speed of communication. So whenever you are communicating to anybody, you should make sure that your speed must be in a pace where the other person can understand. It should not be too fast or it should not be too slow. And the next one here is the intonation. What do you mean by intonation? Intonation means the pronunciation. So it's also very important that, whenever you communicate or whenever you pass any information, whatever words you are using, the pronunciation must be correct. Next is the clarity. So here, whenever you are communicating, you should make sure that whatever information you are passing, it must be very, very clear. If there is clarity in the communication, or if there is clarity in the passing of your information, then only the other people will be able to understand what are you trying to communicate to them. And also the timing. You communicate in the proper timing. For example, if there is something very important that you want to communicate the patient, but if the patient is in severe pain, so no matter how much you try to make them understand, they will not be able to understand this because they will not be in a good state of mind. So what you can do is, instead of communicating to them at that particular moment, you can wait for a while, or you can communicate about this particular information to the family members who is in a good state of mind and who can take a good decision. It is also very, very important that whenever you are communicating, you should make sure that you are sticking to that topic. You should be relevant to whatever information you want to pass. If you go out of the topic, or if you beat around the bush instead of communicating directly of what are the messages you want to communicate, this can also lead to an ineffective communication. So therefore, whenever we communicate verbally to the patient or to the family members as well as to the other healthcare professionals, we must make sure that we keep in mind about the language, about the pacing, intonation, clarity, as well as the timing and relevance to the topic. Now here, moving on to the next one, that is the non-verbal communication. So here, what do you mean by non-verbal communication? Here, this non-verbal communication is a communication which is done through any other signs or symbols. As we've seen that in verbal communication, it means communication through speaking, whereby you will be using words. But here in non-verbal communication, it is just the opposite. Here you will be communicating to the patient, but not through words, not through speaking or your body language. Durable By and Bruton has suggested that body language has several elements. This include the gestures, the facial expression, the posture, the gait, touch, personal appearance, eye contact, sound, as well as silence. So not only necessary that whenever you communicate to the patient or to the family members or to the healthcare professionals, you must only go through the verbal mode, but you can also communicate to them non-verbally. Okay, so what do you mean by gestures? Okay, gestures here means whenever you communicate, or by showing different movement, okay, such as movement in your hands, in your legs, in the body, this will also communicate some messages to the patient. The next one here is the facial expression. This facial expression also plays a major role in communication. For example, when a patient is suffering from pain, you will be able to make out from their facial expression. Even when the patient is sad, anxious, you will be able to make out through their facial expression as well. So this facial expression plays a major role in communicating the unsaid words. Now, the third one here is the posture. What is the posture? The way a person sits, the way a person stands also communicate the untold message. The gait, the use of touch. So here, if the patient is saying that she is not emotionally stable, or she is suffering from pain, just by consoling them, by using this sense of touch, you can also give them an emotional assurance. And then their personal appearance, and whenever you communicate to the client, whether they are making eye contact or not, whether sounds are made or not, or whether the patient is answering back to whatever is being asked to them, or is he just keeping silent, this can also plays a major role in communicating the untold messages. The next one here is the symbolic communication. So this communication involves both the verbal as well as the non-verbal symbolism in order to convey the message. So there are various symbolic communication in which one can pass the information to the other person. Here, as a nurse, if you notice that your patient is not communicating very well, but he is very good in art, or he is good in writing songs, then you can encourage them to do so, because here this art and music is also a part of this symbolic communication. So through their drawings, through their paintings, or through their songs which is written by them, you will be able to find out what are the inner emotions or feelings. This communication also plays a major role, as it helps in facilitating the understanding as well as healing for the patient. Now, moving on to the next one, that is meta communication. So what do you mean by meta communication? Here, this meta communication is the communication about the communication, so that the deeper message within the message can be understood as well as uncovered. So here, for example, when a patient tells that he is cool or he is ready to perform the surgery, but with a rigid body and a sharp voice, this patient, here the nurse can interpret that this patient is anxious, as she has evidence by his body language. So this is also another way of how information can be communicated. Now, moving on to the last one, that is the written communication. Here, from the name itself, we can understand that this is a type of communication in which passing of information will be done in a written form. This type of communication is the most important and the we can say widely used one, especially when it comes to a point where this particular information needs to be recorded, or it needs to be transmitted to a large number of people who are not just present in the same department but in different organization. This is where this written communication comes into action, and this written communication also serves as a best method of communicating, especially when the sender and the receiver are beyond the oral communication medium. So here, these are the various types of modes of communication. There are 5 modes, that is the verbal communication, non-verbal communication, the symbolic communication, meta communication, as well as the written communication. Now moving on to the next one, that is the types of communication. This will tell you on how you can communicate to the other people. The first one here is based on relationship. So based on your relationship with that particular person with whom you want to communicate, there are 2 types of communication. That is the formal communication and the informal communication. As I've explained in the earlier video, that formal communication is the communication which is done formally, which will follow the official hierarchy. So here, for example, if the subordinate wants to communicate anything to their superior, they have to undergo this formal communication. And at the same time, if the superior wants to communicate any information to the subordinate, they will also follow this formal communication. Okay, so now moving on to the second type, that is the informal communication. So what do you mean by informal communication? Informal communication is a communication which will occur without following the official hierarchy. It can be the interaction between the 2 friends or between the family members. Now, the next one here is based on the flow of communication. So as we have discussed in the previous session, that communication can also take place based on the flow of communication. Here, the first one is the upward communication. Upward communication means the communication which will take place from the subordinate to the superior. For example, it can be the communication which can take place, or the passing of information which takes place from the staff nurse to the nursing superintendent. And the next one here is the downward communication. So downward communication means the communication which will take place from the superior to the subordinate. For example, it is the communication or the passing of information which will take place from the nursing superintendent to the nursing subordinates or to the staff nurse. And the next one is the horizontal communication. So this horizontal communication is a communication which will take place between 2 people who belongs in the same category. So it can be the communication among the colleagues. And the next one here is the one-way communication. So one-way communication is the communication which will occur only from one side. For example, it can be the lecture method. So whenever we are delivering any lecture, it is usually a one-way method, as here it is only the person, or we can say it is only me who will be speaking and you people will be listening. So when this communication occurred, this is known as one-way communication. And the last one here is the two-way communication. So what do you mean by two-way communication? Here, as I've said, that one-way communication means only I will be speaking and you people will be listening. Whereas in two-way communication, there'll be an interaction from both sides, whereby not only I will be speaking, but you people will also, get a chance to speak. So these are the various type of communication which can occur based on the flow. And moving on to the next one, that is others. So under this category, we have the visual communication, telecommunication, and the meta communication. So what do you mean by visual communication? Here, from the name itself, you can understand that visual communication is a type of communication which you will be able to understand only through seeing. So for example, whenever you go to any exhibition, whatever models they display, you will be able to understand even without anybody explaining to you about what that particular thing is. And then the next one is telecommunication. So what do you mean by telecommunication? So whatever information you are getting through the television, through the radio, through the internet, this process of exchange of information is known as telecommunication. And the last one here is the meta communication. So as we've discussed, that meta communication is the process of communication about communication in order to know the deeper message within a message, so that the particular message can be conveyed or uncovered. So as I've said that, for example, being a nurse, if a patient says that he is ready for the surgery but with a very rigid body and a sharp tone of voice, then from here itself you can understand that the patient is actually anxious. How? Because you have evidenced it by the body language. So meta communication is the process whereby the person will communicate something else even though he is feeling something else inside. So these are the various types of communication. Now moving on to the next one, that is the factors influencing communication. The therapeutic communication and its effectiveness is influenced by various factors that direct the processes. So these factors can include the first one, that is the attitude. So what do you mean by attitude? So the attitude here of a person, of how he behaves, how he approaches, plays a major role in influencing the communication. Here, being a nurse, it depends on the attitude of a nurse whether the nurse and the patient will be able to establish a good nurse-patient relationship. Or if you don't pay proper attention to whatever they're asking you, and if you just give random answers where at the end you tend to give all different answers, then this will also affect the trust and the value that the patient or the family members will be having towards you. Not only that, but you as a nurse, whenever you use a calm as well as a concerned approach, then this will also facilitate the patient to participate as well as coordinate with their treatment. So these are the various things that you should keep in mind being a nurse before you approach the patient, so that the communication process will be maintained, so that a good communication can be established. The next one here is trust. So as we know that trust and communication is one of the most important element which will help the patient to develop a good self-esteem, a good self-confidence, inner security, as well as courage. So we must make sure that whatever we do for the client, they will be able to develop trust on us, so that this will make them more functional. So the next one here is empathy. Now, being a nurse, it is very important that you must empathize your patient. Empathy means you putting yourself in their own shoe in order to get a better understanding and a clear picture of what their feelings and emotions are. When you empathize the client, then only you will be able to understand and you will be able to work for the betterment of them. Now here, it is good that you should empathize the client, but it is also very important that when you are doing so, you should be able to maintain your own identity. Why? Because by doing so, you will be objective, and at the same time, you will be able to offer support and understanding to the client. So whenever you communicate to the patient, you must try your best to communicate in a language where they will be able to understand, so that no misinterpretation of the message will occur. The next one here is culture. Communication is difficult at its best, especially when the sender and the receiver both belongs from different culture. Then the difficulty becomes even more pronounced. So as a nurse, before you provide care to the patient, you must make sure that you first understand their culture, so that you can do it accordingly. The client needs to feel accepted and treated with respect, even though if they are culturally different. So even though if you belong from a different culture, as I've said that being a nurse, it is very important that before you provide care to the patient, you must first know the culture of the patient, so that you will be able to provide care accordingly. If the patient feels that he is accepted, if the patient feels that he is treated with respect, then only this communication will be effective. And moving on to the last one, that is the perception. So what is perception? Perception is the way events are interpreted through sensory stimuli. The thoughts are stimulated by perception and feelings respond to thoughts. So it is also very important that being a nurse, you must make sure that you perceive things in the right way. In order to do so, you must first have this self-awareness. Only if you are aware about yourself, then you will be able to perceive things in the right way. You will be able to perceive things or to interpret things in the way which the patient wants you to, in order to prevent any miscommunication or misinterpretation of the message. So these are the various factors that you as a nurse should keep in mind whenever you are communicating with the patient, with the family members, as well as with the other healthcare professionals. So now here we have come to the end of the session. So in today's session, we have discussed about the various modes of communication types, as well as the factors that will influence communication. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session whereby we will be discussing about the various methods of effective communication. So until then, have a good day. Thank you.